So good afternoon, everybody, and thank you for those that could stop in and listen to Dr. Mike Stewart this afternoon. He is here with his horse, and he has a few dogs also. Mike is an amazing user of the Pizo Wave, and today he's going to give us some insight onto positioning and use. Now, for your information, Mike has a few, Dr. Stewart does have a few videos on our resource website, and they have a lot of the background about shockwave use and the mechanics of the shockwave. So we're going to leave that out and kind of get right into the practical use and some of the positioning. And I believe he's going to talk about the shoulder this morning. So or this afternoon, excuse me. So Dr. Stewart, it's all yours. I have a chat open so that anybody who has questions can type them in the chat or chime in. And we'll also stop a few minutes early to make sure for questions.
Good afternoon. My name is Dr. Mike Stewart. I'm a veterinarian here in Connecticut, and pretty much my practice is associated with standardbred racehorses, performance horses, and I've been doing it for more than just a couple of years. So the essence of what we're talking about today has to do with Shockwave, Pizo Wave, associated with changing biomechanics and improving not just function but lameness problems, and how it's all related, and how we can take the therapy of biomechanics and how horses function and modify this as associated with treating lamenesses and improving performance. So today, morning or afternoon, however it might be, wherever you are, the important aspect today is going to be associated with the shoulders. Essentially, shoulders with small animals and with horses is basically associated with the large scapula that is designed to float along the rib cage. And so the important aspect of this scapula being a large flat bone gives it the ability to dissipate impact up through the neck and pretty much through the body. So the important aspect of its use is that it must be able to float along this rib cage. And so as we see older horses where this withers becomes like a shark fin, if you will, is a lot of restriction in the fascial attachments of the scapula to the rib cage, withers, and underneath soft tissue. So the important aspect of Pizo Wave, it gives us the ability to loosen this scapula, given its ability to float along the rib cage. Those in the sport horse world know and can perfectly visualize a large, strong, cresty neck, if you will, associated with dressage horses. And that is an incredibly important aspect of all dressage horses. You will never, ever see a successful dressage horse with a skinny neck. The reason for that is, in order to be a successful dressage horse, this scapula has got to float along this rib cage to a greater extent than most race horses or other performance horses, giving it the ability to cross over, bring the scapula out, bring the scapula in, bring it forward, bring it backwards. And so that is really a big part of observing horses with shoulder restrictions and problems, is you'll also see this skinny neck. So the important aspect is that the shoulder is not just about the ability to move the leg. It really is a big part of improving the biomechanics all the way down to the feet. The important aspect is these club-footed horses, you will always observe restriction associated with the scapula. Restriction associated with the scapula here is where the scapula can either be stuck up and it's very, very wide here, or too wide, or it can be stuck down, which creates a shark fin kind of appearance. So the important aspect is that the appearance of how this all fits together is extremely important, and it will reflect in the function of their feet, and you will be able to see problems with their feet, i.e. very upright feet. Club-footed horses will have scapular restriction. And so a lot of times people will want to work on the the feet down here to kind of change biomechanics, when all of that biomechanics, or much of it, is associated with how this scapula does and works up here. So the important part of managing the whole horse really is the element of taking everything into account, all the way from the foot all the way up here to the hair on their withers. Is that kind of coming through okay?
Yeah, it looks great. So just as you're talking, I want to ask one question. In the anatomy, the thing that I think we have a lot of trouble visualizing is, where does the neck hit the sternum in compared to the scapula and the rib cage?
So where we have here is, well, the question is, can you just kind of briefly describe, locations, in regards to sternum, neck, shoulder, and such like that. So just, starting here, elbow here, scapulohumeral joint here. Then what we have is our spinatus muscles here, and the very front of the scapula coming in here. Then we have withers up here. We've done a lot of shockwave work to him when he was not so great a standardbred racehorse, but when he was racing. And then what we do is we come down in here, sternum attaching right down in here. You can pretty much feel it right down in here in the center. So the essence is that, using human anatomy, if you will, our sternum being where our pectoral muscles attach here. So if we can back them up just a second, Kyle.
Wait a minute.
Oh, okay. So, kind of turn them a little bit here. Well, the fundamental situation of what we have is our pectoral muscles attaching to the sternum here, attaching pretty much the shoulder through your, our bicep here, through the center of the sternum here, creating the ventral part of our pelvic sling, if you will. And then we have the very top, which is going to be analogous to where our scapulas meet up here with our spine up in here. Pretty much our infraspinatus muscles are going to be coming in here. Then we have our triceps in here. Extremely important in here as well is our lats and serratus that really give the ability of this scapula to kind of bounce along the rib cage. And then latissimus dorsi coming up in here, associated with the ability to bring this arm back and forth and back and forth. So the big elements here has to do with pretty much in a very similar comparative anatomy, if you will. Tricep muscle on you and I are going to be right in here to kind of hold our elbow and help to kind of create an ability to absorb weight into here, and through the leg itself. So this is pretty much tricep associated with our scapula and elbow, if you will, scapulohumeral joint in here. But the idea is that is pretty much independent of how this is all attached to the body. Just like you and me, our tricep is more associated with our arm, as opposed to our latissimus dorsi in here, associated with the ability to bring this elbow back and forth. So does that kind of lay out some groundwork?
Yeah.
So the essence of where I will focus considerable amount of work is going to be associated with where the scapula attaches up here into the withers, which is pretty much going to be similar to you and I in the very middle of our back, associated with rhomboid trapezius muscles in through here where they attach, associated with the ligamentum nuchae here, and through our dorsal spinous processes here of our spine. And then we have serratus muscles attaching in here as well, creating this balancing act of how this scapula needs to just pretty much rest on the side of our rib cage. And the mobility is extremely important in regards to the ability to stride out well, balance, and turn. So let's get into diagnostics kinds of things. What the heck do you look for on a horse that has problems associated with their scapula? So one of the primary elements is that, and it's very easy with barefoot horses, and it's a little bit more tricky if they're trimmed regularly relative to having shoes, is their feet. So the important part of what I'm going to look for with their feet is with scapular restriction, you have less ability to have a forward stride, so they're less able to land into their heel properly. So what you'll see is definitely these horses will either have a higher heel if they're barefoot, or the element is that you will see that the frog development on this restricted side will be much more atrophied, less developed on the scapular side that has problems. So the essence is that you have to take, holistic maybe is a good, word here of looking at these horses. The other elements of what we have here is with scapular restrictions is what does their neck look like? And realistically, if you are very critical, when you just look at their necks, you will be able to see that one neck, i.e. one side, is going to look far more pleasing to the eye or more developed. The other neck will be much hollower. The other thing that I find from a pain perspective is that it's pretty much hand in glove or pathognomonic that you will run into pain right here, associated with the withers in here, right in here, associated with pain in horses that have restriction to the scapula. And this will be seen on horses that aren't even under saddle. Commonly, people will refer that this is associated with saddle fit, and trust me, it does not. The important aspect is that you will see it much more on the side that has restriction and limitations than it does on the other side. And so, in my way of doing this has to do with pretty much just, putting the palm of my hand on the top of the horse and then bringing my thumb down is where I find this location right in here. And you will see, unfortunately, he's a little bit sedated, but and is not that painful, that you'll definitely get a response, whether it's in their eye, whether it's they're raising their head, or some kind of a pain response. Hopefully you don't get kicked in this area right in here, because what happens is that instead of the weight being distributed through their neck and through their body as it should, it comes straight up the leg and ends up intersecting and creating soreness right here. And so the other aspect is that doing shockwave work to these scapulas will make that pain go away. So the important aspect is we'll see it commonly with horses that aren't even under saddle, that are not even even in work, if you will. You'll see this pain right in this area. And so that is a very good indication in my practice to horses that have restriction in that scapula, is the pain is located right in this area right here. Are we pretty good so far?
Yep. Yep.
So the element of what I'd like to do here now is to kind of set up the shockwave, and we will show what I do associated with the Pizo Wave machine in regards to loosening these scapulas, pretty much from the top. The element there really is that there's very seldom do we really need to do work to the ventral part of the pelvic sling, if you will, in regards to the fact that most all of our problems are going to be up in here. The essence is that the beauty of the Pizo Wave machine is if you think that there is a problem there, it does absolutely no harm in giving it a try and seeing what it does. And so the essence there is I feel that my cliche is that I let the horse tell me in regards to their response, and good riders and good people with good husbandry will be able to tell the difference in how these horses are moving and acting. So we're going to set up this machine here, and then we're going to do a little bit of shockwave work to him. I will show what the settings I use on this machine and why I use these settings. And we're going to just keep proceeding. I set it at 4 hertz in regards to the fact that it just sounds good to me doing that. And then what I do, energy level, I pretty much put it at 15 is where I go. What I'm going to use is a 20 millimeter head. Cindy, if you wouldn't mind weighing in on what the arm is that I use here.
So you have an FB10G6 therapy source. So it has quite a lot of energy, for sure. And its depth of penetration at the maximal, in the center at max penetration is 60 millimeters and distal is close to 80 millimeters. So the way you have it set up, we're going to have the center of the focal zone at about 2 centimeters in 20 millimeters. Yep.
Yep. And so that's where we're going to start. And so I will do a little bit here. What I do is I sedate all these horses because for two reasons. One is to keep everything easy. The second part really is the fact that I can feel the tissue better so that I can really get a sense of the loosening of what's going on. So what I do is put some alcohol on here. Thank you, Kyle, for cleaning this guy up rather than where he was when he was out in the field, just briefly. And then what I use is simple ultrasound gel. I use the alcohol because I think that it helps it to have better contact to the skin. I do not clip any of these horses. I feel that if you use ample amount of conductivity stuff, you can go through even a winter hair coat on these horses. So I do not clip any of them.
Okay.
And so what I do is just get going here. And so the important dimensions are that you have to loosen the scapula from the underneath tissue here. And so the key really is that it has to do with the direction that you're using this. So what I want to do is to get in here behind the scapula, going vertically to basically cleave this scapula from the tissues below it, giving you the ability to come out away from the body, away from the withers. In my opinion, what we're really working on is loosening fascia surrounding this tissue that allows these muscles to start functioning better. So here we go. And so what I do here is start with just kind of going superficially here all along.
Yep.
And so Cindy, if you could, maybe you could allude to the benefits of different frequencies in regards to the different.
Yes. So what we have found from the German medical director is the frequency we don't believe and cannot show that it has any biologic effect on the cells. Our goal with the cells is to turn on mechanical transduction and the healing and pain relief. But the frequency, they say, does not affect that. So it's a matter of comfort, I think, and us being able to see the animal's response and feel the tissue's response. So that's, slower is a little bit easier for us to understand what's going on in the horse's brain and to feel the tissue. But that's, it's definitely a user's preference. Does that make sense to you, Dr. Stewart?
It does to me. I mean, the important aspect of how this physiologically works is to.
We just have to adjust the.
No, back him up, please. Is that we're creating an area of high pressure. In my simplistic mindset, what we're doing is creating an area of high pressure, and that area of high pressure helps to loosen the fascia. Loosening the fascia creates the therapeutic effect of loosening this scapula from the rib cage. In my world, this is a one and done therapy. I do not repeat this in the sense that there, in my world, is not a need to repeat this. I will go with the number of shocks or pulses that I feel are required. And that's the beauty of our Pizo Wave machine, is the fact that since we're not being charged per shock, we can do what we want to in regards to this therapeutic effect. So what we can see here now, if you come to the front, Lisa, a little bit, is that this scapula is already loosened more from his rib cage now than what it was when we started. You see how when he moves there, how it comes out? And that is definitely looser now than it was when we started. And so the important aspect of my therapy is that it's based on response as opposed to any predetermined pulse level. So the important aspect is that there's where sedation, it has its benefits because I can get a more accurate depiction of how the tissues are responding, because we kind of have less of the horse's angst or desire for food or whatever you got going on here. And the idea is, and they will hold more still.
You should also mention how you hold it still instead of just rub it.
And so, yeah, the other element is that Lisa alluded to is the fact that what I do is I'm doing numerous pulses in a certain location, so that in my mindset, what we're doing is we're causing tissues to expand and contract, expand and contract, expand and contract, as opposed to using this in a sweeping motion. In my practice, in the horses that I use, there is a minimal of anesthetic effect. The important aspect is that this is all used for improving biomechanics through loosening tissue, and anesthesia is of zero benefit to my horses in regards to the fact that I will have these horses work light for a couple of days relative to working on flexibility. And then in 1 week, we'll be back to full work. So that the idea is that there is zero anesthetic effect when these horses go back to full work. The important aspect of clinical aspects of what people will see is that after we do these shoulders in this fashion, these horses will be much happier, much easier to work with, and definitely work better. The important part of that is the fact that with the loosening of the scapula, it creates a cushioning effect on their whole nervous system, so that the impact of these front legs will be absorbed into the soft tissue of this neck and body, as opposed to going right into this withers right here, which in my opinion gives horses a headache. So the idea is that you can see that the horses are more comfortable, more relaxed. There was a point in time when I tried to understand why we were having so much neck arthritis with horses. And in my opinion, a great amount of this neck arthritis that you see, not from genetics, which would be wobbler syndrome, but from performance, these performance horses that have sore necks, is all associated with inability of the scapula to float along this rib cage, because all impact that is not absorbed into the soft tissue is going to go into their withers and into their neck, so that now you get all of this trauma into their neck, leading to this arthritis. So the important aspect is every horse that I work on injecting wise with necks, articular facets on these necks, all need to have Shockwave to these shoulders, because you have to go to causation. This arthritis in their neck doesn't come from nowhere. It comes from something. And that something is the inability of this body to absorb impact as it should. So the key really is that injecting necks is a what? Okay, there is pain in their neck, no question. You inject them, they're better. You have to take it a step further, and that is, why is there arthritis in these necks? And the idea there is that it's not because they're twisting and turning their necks. It has to do with the lack of appropriate shock absorption of the scapulas and the front legs into their body, i.e. through the soft tissue, rather than directly through the fascia into the neck and withers. With this guy, what we're going to do is to back this stuff up so Lisa can see, because the idea is that I will use Kyle to show the next form of Shockwave therapy to shoulders, which I find to be extremely, extremely important. So this next form, sorry to back up just a second. What I will do is use this 20 millimeter probe initially. And then what I do is come back typically with a 30 or a 40 millimeter probe further to get down in here. And I will really focus on pulling the horse this way and getting in behind this scapula right here. Chunk to chunk. So you're really coming in this direction, because if you stay horizontal to the horse like this, you're not going to be getting where the problem is, because the majority of this problem is behind this scapular blade, and hence you can't reach it, you can't touch it. This is the only means of being able to modify and improve that tissue. Pizo Wave Shockwave. So the essence is that it is an invaluable tool, and you give it a try and see. It's a game changer. It really, really is. And clients that are in tune with these horses will be able to. The results of loosening are immediate. So the idea is that you don't need to, give it a month and see. You will know the next week the results of what you have. So what we're going to do here now is that Lisa's going to hold the horse, and then we will utilize Kyle to do our next part. So the next part of what we're going to work on, this has to do with the trapezius rhomboid muscles in here, loosening this scapula from the withers in here, giving the ability to dissipate impact into the neck and into the body. The next part has to do with stride length. A big part of what I have with my performance horses is when we have restriction in the lats right here, latissimus dorsi, pretty much similar to you and I, that attaches here, i.e. doing chin-ups and things like this, is the fact that this greatly impacts the ability of this elbow to go forward. In the sense that with all the performance horses that I have, note how far this elbow goes in front of the girth. So that the idea there is that those that are restricted will have lots of knee action without a lot of elbow coming forward. So you'll notice that we have all this knee action here in the front without a lot of this elbow coming forward in front of your girth. And so the essence is that is a significant problem that we've just noted and are able to successfully fix with the Shockwave work. All of this stuff that we're talking about, scapular restriction, latissimus dorsi, are all unblockable, figuratively undiagnosable, because it's all soft tissue. And a lot of this soft tissue situation here may not be painful. It's just that it doesn't move. So the idea there is that even with a lot of massage therapists we do not get that, oh, these latissimus dorsi are very sore. The problem that you have is that they're just not able to be flexible enough, expand enough due to the fascial restriction. So the essence here is that we're going to go ahead and do some of the work here on the latissimus dorsi. From a diagnostic perspective, also what I'll do is backtrack just a little bit, is that when you push in here on these horses, pretty much you're getting back behind the triceps in here, pretty much right where the girth goes, right in this area here is where the latissimus dorsi is, and you will get them to be a little more uncomfortable underneath this area here. So the unfortunate reality is this is a very common area that people use to diagnose ulcers with by virtue of this location, palpating for pain. The other thing is, guess what? That's also where the girth goes. So a lot of these horses with latissimus dorsi restriction and soreness will definitely be more girthy. Because what happens is that girth goes right here over this latissimus dorsi, almost the widest spot right here. And so the beauty is using Pizo Wave, using the Shockwave, this pain will go away as well. So the important aspect is obviously if it's an indication of a bladder point or whatever associated with ulcers, it will not go away. But definitely girthiness, it will definitely help as well. The other thing that has to do with girthiness has to do with their sternum down here. So the idea there is the sternum, like you and I per se, is that the more you have pectoral development under here, the less girthy they'll be. The essence is if these scapulas are stuck up here, you're going to be pretty much in this kind of a fashion where you're not going to be able to utilize these pectoral muscles appropriately, which ends up creating atrophy or the inability to strengthen these pectoral muscles, which ends up putting all this pressure right on their sternum. So the important aspect is the better the pectoral development, the more that your girth is going to be associated with pressure on your pectoral muscles, not on the bones of your sternum. So the important aspect is that you will definitely see better development of your pectoral muscles, the descending pecs and such like this, once you get this scapula's ability to move. So if the scapula doesn't move, you're not going to be able to have good pectoral development. One other thing that I point out to with horses that are associated with latissimus dorsi restriction here, where these are tight. In my cliche, it's like a chicken breast, where you look at the side of these horses, and all of a sudden you have this pectoral muscle that is abnormally sticking out the front, and you have this shoulder that's kind of sitting back here, and that really has to do with the tightness in here with this latissimus dorsi that pulls this shoulder back. And you'll see that these horses will, you look across their chest, and it's, you can see it as abnormal in regards to how this pectoral, and sternum sticks out in front of the scapulohumeral joint here. So that's another element of seeing what goes on with the latissimus dorsi restriction. So the important part, unfortunately, similarly with withers horses that are stuck here, you can either have it stuck up or they can be stuck down. Similar with these guys, is these latissimus dorsi dysfunction can have it to where it can't pull this shoulder back, or it sits too far forward. So the important part is that from a therapeutic perspective, it's very easy to give this thing a try. So what I'm going to do here, my guy here is getting a little impatient, but anyway. Yeah. So we're going to do some shockwave and then yeah, doing the lats. So we're going to go ahead and get to doing it. So what happens here is that it is important to have a good assistant doing this. So when I'm doing the top, I am pulling his weight onto this leg, allowing me to get in here behind here. The essence with lats is that we've got to pull this leg forward, which requires what do we want to call it? A very healthy assistant. So the important aspect is Kyle, my very healthy assistant here, will be able to show what I'm doing here. So we're going to kind of cut to the chase a little bit in regards to doing this latissimus dorsi therapy. And so what I will do initially is to just do this superficially right over here with the same 4 megahertz 15 energy level. What I'm going to use is a 20. So what we're going to do here is we're going to just say, I'm going to go here for a little bit in regards to doing that. And then what we're going to do, since we're running out of time and running out of patience on my guys, is that we come in here and Kyle pulls this leg forward here, and I come in through here, and he will be able to tell me where a lot of this tightness is. And we do have a lot of tightness associated with our tricep muscle, and you can see his response. And what I do here is I will really work hard on where we get the most responses. So you can see right here is where, Kyle is alluding to where we have the most change in regards to his response to this. And what they do is they'll stick this leg out further once we loosen this stuff up. So what will happen is that you definitely see that the horse enjoys pulling this leg forward when we loosen this up. So he really, really is going to tell us where the tightest spots are associated with this latissimus dorsi. And there is no potential for damage associated with internal organs, heart, lungs, anything like that, doing this along his rib cage. There is no problem here at all, no concern. And so the essence here is he's a little more reactive because we usually have him a little more sedated, because we usually get started a little bit quicker into doing this. But the idea here is to illustrate that the horse tells you where the tightest spots are. By virtue, you can see right in here, associated with coming in behind this elbow, down along this tricep, right in here, is the latissimus dorsi therapy. And it works. It just plain works. Because the idea is that the biomechanics on these horses will be different the next week. Okay, that's where we go here. And so that, I will do this much more than this. What we've used with the top and the bottom here is 1,300 pulses. it's not uncommon for me to do 3,000 or more pulses for therapy on a horse, which is the beauty of this machine, is that it doesn't cost me per shock. So I don't really even consider how many I'm doing, because all of my therapy is to effect. So that the idea is that gives me the chance of just doing one and done, and it will create the desired therapeutic effect based on changing their mechanics. So what we have here with this latissimus dorsi is that they will get rid of a lot of this knee action here and be able to get that elbow in front of that girth, being able to give them the ability, to move this arm much better, because now we can get this out in front.
I have one question about your overall, when you are working on a horse that's, as you said, they're going to have maybe a little bit of a light week, but they're basically in work. Do you have any?
You have to stay in work.
Yeah. Do you have any strong feelings about doing everything bilaterally versus one side versus the other?
You definitely do bilateral.
Okay,
so
that's what I
said. Because the important part of what I've learned is when I first started doing this, we would do the bad shoulder.
Right.
Well, 3 months down the road, the bad shoulder was working better than the good shoulder. Not that the good shoulder went bad, but the improvement on the bad shoulder made the good shoulder look worse. So everything I do on both sides.
Okay.
Pretty much equally. And equally means to effect. So equally may not be the same amount of pulses, but the essence is that equally means I will work to, quote, my satisfaction on both sides.
Perfect. Well,
to this end, very commonly, I will only do one of these at a time, because the important aspect is that when changing biomechanics, the more that you want to change, or the more, if you try to add too many locations, whether we do shoulders, lats, backs, hips, stifles, things like that, the more different spots you do, the more you're going to dilute the therapy. So the idea is that we want to really focus on one specific area to maximize the benefit of changing the mechanics of this elbow, of changing the mechanics of this scapula here, rather than trying to change a whole bunch of things at one time. And so there is not time in this venue to speak to my rehabilitation process with these different areas, but there are different processes, physical therapy programs that I have depending upon the area that you use. So that, because the key is changing how they move. It's not pain relief, it's changing biomechanics. Because in my world, biomechanics is taking pain a step further to alleviate the cause of the pain rather than treating pain, relieving pain. Because the idea here is that a lot of these areas that I'm working on are not pain related. So that you could give them all the pain medicine you wanted to, it's not going to change them at all. So the important aspect, that's where your eye and your understanding of biomechanics is key to changing these horses and understanding what you're doing. Because it's not, you can't change any of this with carbocaine. It's not going to work because it's not associated with pain. But trust me, if you don't correct these things biomechanically, you will have problems in their feet, ankles, suspensories, and things like that. Those things will block out, but now you're well down the road of the biomechanical problem. So the idea is when you start to run into these feet problems, you have to take into account that whole leg, that whole horse. And that's where it's so important to understand what you're doing biomechanically or what they're doing or not doing biomechanically.
Yep. Great. What a good boy. Thank you.
Yeah. Oh, yeah. And so anyway, what we're going to do is say goodbye to him, and I'm going to bring my two, pesky little canines out here, and we'll talk about, very similar effects on these two guys.
When we talk about dog shoulders, we get a lot of issues with medial shoulder instability, and the dog shoulders tend to have much more lateral movement than the horse shoulders. What is that?
So the important part here is that we have two guys here. Sit, Gru. Sit. So we've got Gru, who is Golden Retriever and Saluki. And then we have Toby, who is obviously very Jack Rushley. So the important part of what happens here is that we have two different types of shoulders here in regards to these. I mean, we have one that's a Schwarzenegger, and i.e. Toby, and then we have Gru here, who has shoulders almost like a cat. So the important part of what goes on here is that it's very important that the scapula relative to Gru, who can run 35 miles an hour, good girl, is the fact that they are much more mobile. And so when you feel these scapulas here on her, these scapulas are sticking well out above her spine right here. And so she's almost like a cat in regards to the ability of these scapulas to move. And that is necessary for her to be able to go that fast. So when we talk about, this is a great view here. So the important part of stability of these shoulders, in my opinion, has to do with the structural integrity all the way along the withers area, if you will, the top of the shoulder, giving this shoulder the ability to work independently. So the important part is that we will run into a lot of bicep problems here. Yeah. And scapulohumeral joint problems here. We're assuming that they're not OCD related, if you will. But the important part of what goes on has to do with the ability of this scapula to be able to float along this rib cage up and down on dogs that are going to be doing a lot of running or jumping and landing. So the important part of it is that it needs to, in a very similar fashion, take this pressure and put it into her rib cage and up into this neck here. So the important part of it is you see problems here, because what happens is that if this scapula doesn't float up here at the withers, then then this impact was going to create this torquing action to the scapulohumeral joint and bicep area. The other, and so what happens is over time you get a degree of scar tissue in through here, and the scar tissue becomes restrictive in and of itself. And now you end up dealing with all of this here, when in reality, what's going on is that all of this impact is all getting torqued here in the scapulohumeral joint, bicep area, and spinatus muscles and such, because it's not being able to be transferred further up the leg or further up the body and be dissipated in through this body. So the important part of it is that we have to be able to create flexibility in through the back of this scapula, giving the scapula the ability to come up and down, which will take the impact out of this scapulohumeral joint there, i.e. this medial stability. So the important part is that this medial stability has to do with everything floating. So if everything doesn't float, then what you're going to happen is that you're going to have one focal area that's going to take all of this hammering, if you will. So what we're going to do is try and find Toby. Here, we're going to bring Toby over here. Here's a little beast. Here's my little beast.
Maybe if you pick them up, it'll be a little easier to see.
Yep. So anyway, it's all right. Group stuff. So here's our, well, just around a year-old Jack Russell. So the important part of him is obviously he is pure beef. But the important part of him is the fact that his scapulas do not move like hers do. So the important aspect of what goes on with him has to do with the fact that him doing lots and lots of running is going to create problems, because he cannot, this scapula right here does not move with him like it does with her. And a big part of that's genetics, in regards to how he's put together, which is like a tank here. But the important aspect is that, let's just say, oh my gosh, he does, and we do, and we run into problems. You're going to have to, in a very similar fashion, shockwave around in here to create this leg going up and down, rather, because what's going to happen is all that impact is going to go into these elbows, into this medial part of this shoulder, because what's going to happen is that this shoulder is going to go out like a chunk, a chunk, a chunk, a chunk, a chunk, when the weight comes into this leg, if it doesn't come all the way up into this body. Does that kind of illustrate this? So the important aspect of what we've had, and I apologize, a little bit of the Stewart dance here, is the fact that we have a lot of show dogs that really look pretty because they're doing this kind of action, chunk, ka-chunk, ka-chunk. And what happens is all of those show dogs that are successful in time are going to run into neck problems, because instead of being able to take that shoulder and kind of slide it out like this, like they're designed, they kind of do one of these numbers, which kind of looks pretty and in the show ring does have its merits. But the problem was we really had a lot of the Westminster dogs that really ran into shoulder neck problems, because whether it was created or just the way they were, these problems ended up creating lots of neck and shoulder problems. And so there again, what we're doing is doing shockwave work in through here to give them the ability to slide that scapula and shoulder forward instead of one of these kind of numbers with the dogs. And there again, you know, it has to do with, if that impact is not sliding backwards to the spine back here, it's all going to be taken right in here into and that's where this medial stability element comes from. But there again, it's understanding, okay, that's where the pain is, but that's not necessarily where the problem is. So, you know, you have to take it a step further as to causation rather than, okay, you know, he's hurt his bicep. We got, you know, bicep problems. We got shoulder problems. We're going to alleviate those shoulder problems. But unfortunately, in the end, it's not going to take you where you want to go, because, you know, in the end, you're not going to causation, and causation has to do with the function of that scapula along the rib cage.
Cool. Now, those are interesting points to think about. How the lack of movement in the scapula can increase the instability in the medial shoulder. That makes a lot of sense now, more sense than it did before.
Right, because the idea, unfortunately, is that this is what we do because this is where the pain is, but it's like, well, why is the pain there? I mean, where does this come from, and how do we not just address the pain, but address causation of that pain? Because that's where real success is going to come from, is addressing why it's there to begin with.
Perfect. Does anybody out there in our audience have any specific questions for Dr. Stewart? Silence.
Yay! That means we're perfect, right?
No, it was very, very useful, and very useful for me as a horse person by life and being trained in dogs to kind of make the comparison of the horse and the dog.
Yeah, and so the beauty of our Pizo Wave machine is where a lot of this stuff that we come up with is somewhat, we're going to say, trial and error, but the idea is giving things a try, looking for results, and with this therapeutic approach and therapeutic device, we have that ability that really is very, very hampered in the use of other shockwave machines, because I've used other shockwave machines and there really is no comparison in regards to the flexibility of therapy, as well as the therapeutic and financial benefits to me and my clients. It works.
Great, great. Well, I really appreciate you and all your team's effort to put this together, and it was very useful. Nice to have the live animals for sure, but not easy, so I appreciate it. And I mean, you sedate them lightly when you treat the horses, but what do you use? A little bit of ACE?
So what I do, so the sedation that I do is 0.3 for a full-size horse. Well, unfortunately, sometimes ponies almost take as much or more.
Yeah.
But is 0.3 cc's dormosedan and a half a cc of ACE.
Okay.
And that pretty much gets us where we want to go. Just the essence is to just take the edge off. We don't need heavy sedation. It's not painful, but the essence is the tenser they are, the more they move around, the harder it is to really feel that tissue. And so the key really on my end is that I go till I'm happy with how that tissue feels.
Good. Yeah. And it's a very light sedation. It's not like you're knocking the shit
Oh,
out.
yeah, right. I mean, the essence is by the time we get the horse back and get done, they can go back in the stall, eat, drink, whatever. I mean, there's not a, concern of withholding feed, grain, water, whatever, after the therapy by virtue of the lightness of our sedation.
Yep. No, that's awesome. Super appreciate your time and effort and everybody's effort. And I think the visuals were awesome. Everybody in the chat says thank you. And I know Chrissy's going to go out to her backyard and play with her ex-thoroughbred racehorse when she has time.
Well, and the idea there is it's very, very interesting. I mean, that to see the whole horse, look at the whole horse, and you look at one side of that neck and it's like, ooh, it's kind of thin and not so pretty. You look at the other side, it's like, well, I don't have a complaint looking at this side. And that really is a reflection of that scapular mobility.
Yeah.
And those that are in the performance horse world is in, you close your eyes and you think of this beautiful dressage horse and it's got this beautiful neck. You will never see a successful dressage horse with a skinny neck.
Right. No. And the asymmetry for me who rides, I feel it when I'm riding better than I see it with my eyes. But
oh yeah, exactly. And that's where the key of my education and benefit has to do with feedback that I get through all of my clients. Yeah. Because everything's a win. If it does exactly what I hope and expect it to do, that's great. If it doesn't, then we pursue it to say, okay, we loosened this area. It didn't necessarily accomplish what we wanted to accomplish. Why didn't it work? And that's where the advancement into doing the latissimus dorsi muscles was the fact that we did these shoulders, scapular, up in the withers area, didn't quite get us where we wanted to go. So then we come back and look further. Then that's where we found out, the therapy associated with this latissimus dorsi.
Awesome. Cool.
And it's all a matter of, well, let's give this a try and see what it does. And that's the beauty of this therapeutic approach and this therapeutic machine is the ability to try things.
Yep. There's no danger. Try it.
Exactly.
Cool.
Exactly.
Cool. Well, thank you. I appreciate your time and effort, and we'll see you this weekend.
Go San Antonio.
We're off to AAP.
Thanks. Bye-bye now.
Thank you.
Thanks, Dr. Stewart. Thank you.